Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with us.
Hello, ladies and gentlemen. Welcome to another session of the online pregnancy school. How are you doing? We thank God for another day and another opportunity to discuss health that will be good for the whole family. If today is the first day you are joining us, this is the online pregnancy school. And here we talk about women, children, men, the elderly, adolescents, and in fact the whole family. And did you know that November 19th is International Men's Day? And therefore it will be good to look at issues to do with men and how we can work together so that men stay healthy. If this is the first day you are joining us, I'd like to encourage you to subscribe to my YouTube channel, The Online Pregnancy School with Dr. Linda Vanutu, and on Facebook, The Pregnancy School. You will learn a lot, and if you haven't done that as yet, please go ahead and hit that subscribe button. Remember to turn on the notification bell because there are so many things that we have done and a lot more that we are going to bring your way. So please go ahead and hit that subscribe button and also share with friends and family. So, though this is the online pregnancy school, today I'm going to talk about another topic that will be helpful for men. But the women also need to know so that they can share with their husbands, their friends, their brothers, their uncles, fathers, every man that you know, you can share with that person. So let's look at today's topic. I'm going to look at gonorrhea in men. I'm sure a lot of people have heard the name gonorrhea. Some people just cut it short and say gono. So that is what I'm going to talk about today. Gonorrhea is one of the diseases we call the sexually transmitted infections or diseases. And that means that the name tells you where it can come from, right? So it can be contracted through sexual activity. Now, it is caused by a bacterium. You don't have to know the name, but it's also good to know that it is caused by a bacterium, which is the gonorrhea bacterium. It has its own name, Neisseria gonorrhea. And this is a bacteria that likes moist places of the body. So if you look at your body, you find that immediately you know where it is moist, right? So it likes those places, and those places are also warm. So the bacteria can affect the human body in places like the mouth, the urethra, that is where the urine comes out from, the throat, the eyes, the anus, the vagina of the female, as well as the reproductive tract in the female, which means that can affect the uterus, it can affect the cervix, and also the fallopian tubes. So the bacterium likes these places, and we'll learn more as we go along. But remember that today I'm going to focus on men. Just as the name says, the disease is contracted or transmitted from one person to the other through sexual contact. And this could be because the male has it or the woman has it. And it can be transmitted in any form of sexual activity. We know that for some people, they don't just do the female genital and the male genital, but they also have anal as well as sex in the mouth. And therefore, these are the reasons why a person who is infected can infect another person if they indulge in such activities. Now, you don't necessarily have to have an ejaculation, which means that you don't have to have the man dispersing their sperms or bringing out any ejaculation before the transmission can take place. And let's just add here that it can also be transmitted from a mother to her baby during childbirth. So for the women, though we are not talking about women today, it's good to note that as a woman, if you have the infection and you are pregnant, you go to deliver without knowing that you have it, you can transmit it to your baby. Ladies and gentlemen, today I'm talking about gonorrhea in men. And we want to give the background so that we know that it's not just men who can be infected. Women can be infected as well as babies. So that is good to know. It is also important to note that even if you have had gonorrhea before and had treatment, you can be reinfected if you meet somebody who has the infection and you have sexual activity with that person. You can be infected. It is not a disease that once you have it and you are treated, you cannot have it again. That is very important to note when it comes to the prevention. Today I'm talking about gonorrhea in men, and we are learning things that will help us to live healthy lives. Ladies and gentlemen, gonorrhea is a very common infection. That's why I said that I'm sure a lot of people have heard the name. And it is estimated that there are millions of people living with the infection throughout the world. So it is quite common. However, a lot of the times, the people who have the disease may not even show any sign, what we call the asymptomatic. So they may be asymptomatic. So it means that even the cases that are reported to be in the millions may actually be lower than what the true picture is, because there are some people who have it, they haven't shown any signs or symptoms yet, so they do not know, which means that such people will not be counted as part of the number of people who have the disease. I hope we understand. So that is an important thing. And this is important to note because somebody can have the bacteria in him or her, but it can be lying dormant without showing any sign or symptom for a long time, up to about a year. Can you imagine? So it is important to note this, that somebody can have it, may not show any sign, and the bacterium can be in this person for up to 1 whole year without showing any sign in this person. We get it, right? And the majority of the women who have it are actually asymptomatic. They do not show any sign. And then up to about 50% of the men or males who have it also do not show any sign. So it means that within the population, if you take 100 people who already have the disease, a lot of them that are women will not show any sign. So the person they are engaging in sexual activity with may not know, because they themselves do not show any sign, so may not even know that they have the disease. Likewise, the men. So this is very important for public health reasons. However, it is important to also note that anybody who engages in sexual activity, especially for those who are not with their husbands or wives or the same person, stand a higher chance of getting the disease. Now let's zoom in on the men or the males. Now, as I said earlier, many of them, up to about 50%, may carry it and will not know, so they are asymptomatic. But when present, they have signs and some symptoms that will tell them that they have this disease. And some of them are that the man would now have pain when he goes to urinate, what we call dysuria. So normally, you know that when you are going to urinate, there shouldn't be any pain, there shouldn't be any burning sensation. The urine should just flow normally because it's a physiological thing. It is something that should happen. But when somebody has this infection, it would happen, or it is possible that this person would now have pain when he goes to urinate. Some of them may also have a discharge, which can be white or yellow or even greenish, Where the urine comes from the man, is called the urethra. The women also have it. But this tube, so as you go to urinate, you find that the urine is coming from the tube. You cannot see the full tube, but when you look at the tip of the male organ, you find that this is where the urine is coming from. And from the same spot, you can have this whitish or yellowish or sometimes greenish discharge. And this happens usually between 1 to 14 days after the person has become infected. So if somebody meets a woman today and this woman has the infection, the day after, the man can start having this painful urination, or it could take up to 14 days before this man sees anything, either the pain or this discharge that we are talking about. Now, in some cases, in addition to this urethra, this tube that the urine comes through being infected, the organism or the bacteria can also go down into the scrotum and into the testes. And when this happens, then there's also pain in that area. So in addition to you urinating and having pain whilst urinating or the discharge, you can have pain in the scrotum. The scrotum is what hangs down there with the testes inside, and the testes can also be infected, as well as there's a tube that links the testes. When you examine yourself, you find that there's a tube inside that can also be infected. So this can happen in the male who has an infection. Ladies and gentlemen, if you have just joined us, today I'm talking about gonorrhea in males. And it's a very common thing. It happens to a lot of people, but they may not know that they have it because it can lie dormant for up to 1 year. So in addition to these common places that the bacteria can go to, which can show as I have just described, there are other parts of the body that the organism can infect, and that will also show in the man. One of such places is the rectum. The rectum is the end of the intestines, from where we get the anus, from where the feces come out from. And if somebody has an infection of that area, then they could also have a discharge, which can be similar to what you see when you have a boil, what we call the pus. So it can happen like that. Or it could even be that the person will see bright red blood coming out from the rectum. And then when the person goes to toilet, the person, after cleaning himself, would also find that there are some spots of blood in the tissue paper. Remember that there might be other reasons for bleeding in the anal region. Some people have piles, some people have constipation. So when they go to toilet, they have to strain a lot, and that can cause some fishes or some small cuts. So it is not every spot of blood that you see that is related to gonorrhea. But we are just saying that when somebody has gonorrhea, which has affected the rectum, then it could pass out as blood, so the person can see blood. There could also be itching. At the anal region, the person can be itching so badly that it becomes very, very uncomfortable. Again, there might be other reasons, but we are just telling you that when somebody has gonorrhea and it's affected the anal region, then this can happen. It could also be that this person will be straining a lot when the person goes to toilet. Of course, if you have constipation, you will strain a lot at stool, but these are some of the signs and symptoms that you will see when somebody has gonorrhea that has affected the rectum. Remember, I'm talking about men, but it can happen in other places as well. Now, gonorrhea can also affect the eyes. I said earlier that the bacteria likes the moist places, and everybody knows that the eyes are moist. So that can also happen. And when they affect the eyes, then the person may have pain in the eye, may have discharge, which is similar to pus, which is what we see from a boil coming out from either one or both eyes. And this, of course, makes the eye also very sensitive to light. When light shines on it, the person has pain. And especially in babies either male or female, born to mothers who have gonorrhea, the eye is one of the areas that we see very, very, very often. You see that there's this whitish fluid coming out, like pus coming out from the baby's eye. It can happen if somebody has gonorrhea that has affected their eyes. So that's another place that it can happen. Another area that we can have an infection is the throat. It can affect the throat, and here it may be asymptomatic. It will be there but will not show any sign, or will show signs and symptoms. And these include a sore throat and swelling of the lymph nodes in the neck. We have lymph nodes around different parts of our bodies. And these are the things that when you have a cut or something somewhere, you find that there's a bump somewhere. So if somebody has gonorrhea that has affected the throat and it's not even showing any sign, the person has not shown any sign yet, it can show as the sign with the lymph node swollen, or the person might have a sore throat. Please remember that sore throat is not just present in gonorrhea. It can happen in different places. When the weather changes, people have sore throats. When they travel to dusty areas or places that are very dry, they may have sore throat. But when you have gonorrhea that is affecting the throat, the person can also have a sore throat. It can also affect the joints. We don't want our joints to be stiff. We don't want our joints to be painful. But gonorrhea can affect the joints. And when this happens, it can affect different parts of the body. And what happens is that they become warm. Sometimes they are red and extremely painful, especially when they are swollen. So you can have somebody who has gonorrhea that has affected the joints, and this can be a painful thing for this person. Ladies and gentlemen, this is the online pregnancy school. Yes, it is the pregnancy school where we are looking at men. In November, we are looking at male health issues because they have to be healthy to ensure that we have healthy babies as well. So this is talking about gonorrhea in men, one of the common sexually transmitted infections that we have around. And if you haven't done that, please go ahead and hit that subscribe button. Also turn on the notification bell so that you don't miss any session that we bring your way. And also remember to share your comments with me. Give us a feedback on what we are learning, and let's know if you have any questions. Just send me a question in that comment section and I'll come back and answer the question for you. So, what are some of the complications that can occur? And this is key so that we try to avoid getting gonorrhea. If gonorrhea is untreated, it can lead to serious complications and health problems in both men and women. And you see, once a man has it and has an affair with a woman, the man can transmit it to the woman and vice versa. So it is important that we learn about what can happen and how we can prevent them. If it is left untreated, what this can do, the disease can spread through the person's blood, and that is a serious infection. And when this happens, it can affect even the heart. We have inside the heart what we call the valves. The heart is divided into different sections. So we have the valves. And when gonorrhea spreads through the blood, it can go into the heart and affect the heart valves. And when this occurs, it means that it will affect the heart opening sections, opening and closing, the blood being oxygenated, moving through the body, the deoxygenated blood, or the one that has gone and done its way coming back into it can affect the heart's performance because the valve is affected. So gonorrhea left untreated can affect the heart. It can also affect the brain, the lining of the brain, as well as our spinal cord. So once gonorrhea is not treated well, and it stays in this person's body, then it can move round. Please, we are talking about men, but this can also happen in the woman. It can happen in the woman if it spreads into the blood. So we can have the pains, as I talked about. Some people, it can affect the skin. They have a rash, which is difficult to treat, and it can be life-threatening with the blood dissemination. This gonorrhea going through the blood, it can be life-threatening, which means that it can lead to somebody passing on, unfortunately. And also, it's been found that people who have one sexually transmitted infection have a chance of having another one, because the other disease is also transmitted sexually. And so HIV and other diseases can also be transmitted, or this person can have it as well because of the route of transmission. So it is important. Another thing is that men who have the disease can have an abscess, or some people call it a boil. It can have an abscess in the penis, getting to the end of the penis, and that can be very, very, very painful. They can also have infection going to, there's a tube right from the inside where the testis is, where the sperms are produced, the tube that it has to pass through. A whole lot of things can happen. So that part can also be infected, and that can be painful. And what it does is that once this happens, it causes the things to stick together and then also become like a scar. You know that when you have a scar, it never looks like the original skin or wherever the scar is. So this, when it happens, these are some of the complications that can occur with the male organ and the reproductive system as a whole. So there can be scarring over there. And there could also be inflammation of the spermatic cord. The sperm has to come out through something. And all these things can be affected. The men have what we call the prostate. I'm sure a lot of us have heard of the prostate. And if we have gonorrhea, which is not treated very well, then it can affect even the prostate as well. And this is not good at all, because the prostate plays a part in the man's body, and it has to be of a certain texture, it has to be of a certain kind, it has to be healthy for it to perform its work. And also where it is placed, if it doesn't work well, then it can affect other things. Now, all these things can cause a lot of pain. And as if that is not enough, ladies and gentlemen, it can also lead to an increased risk of bladder cancer. Remember that it has gone through the body, so it can go anywhere. And if it is not treated very well, then it can go anywhere. And that is a challenge for everyone. Now, with what I described earlier about the male organ and the rest, and the bladder and all that, and the scar that can happen, if this happens and it affects where the urine has to come through, you find that the inside becomes smaller, and therefore urine becomes difficult to pass through, and that can lead to the man having this retention of urine, because the urine cannot pass through the tube that it has to pass through. I hope we are learning something. Now, with all that, ladies and gentlemen, what can we do to prevent such a disease? As the name suggests, it is sexually transmitted. So if you haven't had any sex with anybody who has the disease, then of course you don't stand the chance of getting infected. But if somebody has been diagnosed with a disease like gonorrhea, the best thing is for this person to have treatment. So whether it is you or somebody you know, your partner, it is important that that person goes for treatment. Please do not on your own start treatment, because we want to prevent some of these complications that I have spoken about. So if you have the disease, you should tell your partner, because it can be transmitted through the mouth or the private part or the anus. So no matter where you want to have your sex, it can be transmitted from that place to one person to the other. So it is important. Another thing that can be done is that we reduce the risk of disease by limiting the number of people that people have sexual affairs with. It is very, very, very important. So if you know that you are that person who has been unfortunately moving from one person to the other, please note that some of these people may have the disease but may not show. So the chances of having this are higher. So you limit the number of people that you have sex with. Now, if somebody has had the disease and it has gone for treatment, it is important to make sure that they complete the treatment. Please complete your treatment so that you don't transmit the disease to somebody else. It is really important. So that is something we need to do. Now, for the prevention, ABC has been used that the best is to abstain. So for people who do not have that edge to stay away, if you do, please, it's important that you stay away. So the abstinence is key. That is the surest way to prevent a sexually transmitted infection. The other thing is that people are encouraged for prevention to take place to be faithful. If you have a wife, you stay with your wife. If you have a husband, you stay with your husband. So people are encouraged to be faithful as much as possible when it comes to sexual activity, because the more sexual partners you have, the higher the chances of contracting one sexually transmitted disease or another. For others who have been diagnosed, who are not sure whether they are treated and they are okay or not, and for other people, it is suggested that they protect themselves and their sexual partners by using the condom, because that's a barrier method that will prevent you. So we start with the abstinence and then being faithful. But for those who want to go ahead and do that, then you have to use the condom to prevent yourself from being reinfected, because I've said that you can be reinfected. The fact that you had a disease once doesn't mean that you cannot have it again. Ladies and gentlemen, if you have just joined me today, I'm talking about gonorrhea in men. And if you haven't done that yet, please go ahead and hit that subscribe button. Also follow me, The Pregnancy School, Facebook, and share your comments and your thoughts with us. And please share with friends and family. Now, can this disease be treated? Yes, it can be treated. And that means that if you go to the right person for treatment, you will be cured. So you can be cured, so to speak. But again, please remember, reinfection is common, and therefore you have to go by what you do to prevent yourself from being reinfected. But once you have gone through treatment, it is suggested that you have yourself tested again in a couple of months to be able to know that, yes, I have been treated. When you go to the hospital and you share your story as to whether you have pain when you urinate or you have seen this discharge, then a laboratory test will be done, and that will confirm that you have the bacteria or you don't have the bacteria. So the diagnosis is made based on your history. That is what you tell the doctor or the healthcare provider, as well as the lab tests to confirm that you have this disease, and then you'll be treated, because there are medications for treatment. But of course, I will not mention the medications here. If anybody has any discharge, or you urinate and it is painful, or you find anything that is abnormal, or you know that the person who you have been having the sexual activity with has complained of any pain or discharge, then this is the time for you to go to the hospital, see a doctor, get yourself checked with a laboratory test. They would know whether it is gonorrhea or not, and then give you the appropriate treatment. Yes, so treatment is possible. Ladies and gentlemen, today I have shared with you gonorrhea in men. It is an important topic and it is preventable. But if we do not take care and we don't go for the right treatment, then the complications can be life-threatening, even in some instances. That will affect the quality of life that we have. So, to conclude, I'd want to say that please be careful. You can't prevent yourself from having a sexually transmitted infection by avoiding multiple sexual partners. That is key. Again, report any symptom that you have. Normally, when you are urinating, it should not be painful. There shouldn't be any burning sensation. But if you realize that you have that, please do not be shy. Go to the nearest hospital and let them be aware. It is also good that you go with your partner, or you let that partner also go for treatment, because it is good that we prevent the spread from one person to the other. The other thing is that do not self-medicate. Don't just go to that drugstore somewhere and say, I'm going to buy myself some medication, or I'm using anything that I know to treat myself, please. Because it is good that you have the diagnosis made, you have the correct treatment, and later on you can have a check again to make sure it is gone. Because it doesn't just affect you as an individual, it will affect that person. Maybe you'll not even marry any of them that you are having the affairs with now, but you may go ahead and marry somebody else, and you may transmit it to that person, who can become pregnant and also transmit to their child, So it is important that we try to prevent the spread from one person to the other. Also, when you go to the hospital, even if you had a urethral discharge, you saw a discharge about 10 years or 20 years ago, please, when you go to the hospital, tell the doctor that so many years ago I had this problem, so that they will check for you, because I've given you the list of complications that can come about. And I also mentioned that you can have cancer of the bladder. So it's important that when you go to the hospital, it doesn't matter how long ago you had that urethral discharge, and this one is either male or female, whoever you are, please share that with the hospital and let the doctor know. Then they will know how to treat you. Or if you have infertility, because this can cause infertility in the male as well. Once it's affecting the sperm, the scrotum, the testes, the everything, and in the woman, the fallopian tube and all that, it's affecting the reproductive organs. It means that it can lead to infertility. And with the scarring that I spoke about, with the reduction in the tube, where whatever has to pass through, all those things can affect the fertility of the male. So if you've ever had it and you are going through any treatment, no matter what it is, please share that with the doctor, that many years ago I had this discharge. That will help to make a better diagnosis and therefore treatment. I would also want to encourage you, please share with friends and family. Let people know. We know that sometimes people have these things and they stop. The discharge stops, so they think that that is okay. It is good that it has stopped, but make sure that there is no residual damage. So please go to the hospital, have yourself checked, and let the doctors confirm that you are free from gonorrhea, and therefore you can go ahead with your life without any hitches. Well, this is where I end today's session. So if you joined me today, I want to say a very big thank you to you. Please continue to share with friends and family. And if you haven't done that yet, go ahead and hit that subscribe button. And on Facebook, follow me, The Pregnancy School, and the magazine. If you have a sister who is going to get married, you have a wife who is already pregnant, please buy a copy of the magazine, Promise from the Womb, and share with them. They will learn a lot about pregnancy in very simple terms that will help them to identify any challenges that come their way and report quickly to the hospital. Because what we are trying to do is to help reduce preventable maternal and newborn deaths around the world every year. Over 2 million babies are born dead. A huge number die within the first day. Another huge number die within the first month. And some of these are preventable. Likewise, women Around the world, every day, a woman dies from pregnancy-related complications. Most of these are preventable, but if they do not know that this is a complication, they will stay at home and get to the hospital late. So know more about pregnancy, about childcare, and everything that you need to know to make pregnancy a time of joy and not anxiety or fear. I'll see you in my next video. Stay safe. Bye for now. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare with us.